Namaste friends, I'm Dr. Toishi Sharma, Interventional Cardiologist. What if you've been told you have a 90% blockage in your heart artery, but you feel absolutely fine? Let's talk about what that actually means and why in most cases we don't even test people without symptoms in the first place. First, let's be clear. If you don't have chest pain, shortness of breath, fatigue, lightheadedness, dizziness, or abnormal previous testing, then routine angiography or CAT scans are usually not recommended. Guidelines discourage testing in asymptomatic patients because it can lead to unnecessary worry, stress, and unnecessary procedures that could be harmful and risky. So now let's talk about what if you are asymptomatic and a 90% blockage has been found. First of all, why can someone be asymptomatic with a 90% blockage? So firstly, your body may have developed collateral vessels, which are body's natural bypasses created to overcome the reduced blood flow caused by the 90% blockage. Number two, you may not be exerting yourself or stressing yourself enough physically for the blockage to provoke chest pain or shortness of breath. So if you have a 90% blockage and you are not symptomatic, try to assess whether you are actually stressing yourself enough and are you truly asymptomatic, because many patients these days have a sedentary lifestyle, and that means that you actually may be symptomatic, but it's just that you're not working that hard. And number three, you may have a high pain threshold. Many people simply don't recognize symptoms because of a higher pain threshold compared to someone else who may have a lower pain threshold. And number four, that 90% blockage may be in a small blood vessel which supplies a small part of your heart, and that's why you may not be having chest pain or other symptoms. Now let's see if a 90% blockage is really dangerous or not. So yes, friends, a 90% blockage is considered a severe blockage, whether you have symptoms or not. So what should we do about it? If you have a 90% blockage and you are not symptomatic, then we have to closely look at the fact where the blockage is located. Because if the 90% blockage is located in a left main artery, or it is located in a proximal part of the LAD or left anterior descending artery, or if the 90% blockage is in multiple blood vessels, then this can be the threat to life. Therefore, we do recommend that it be fixed under most circumstances so that we can decrease your risk of a major heart attack in the future. But friends, if the 90% blockage is in some other artery, which is not the left main artery and not the proximal LAD, and you are asymptomatic, then we do not recommend stents or surgery in most cases. Regardless of where the 90% blockage is, you should be taking medications that will stabilize that blockage and will prevent the progression of that blockage. So medical therapy will be the most important therapy for this asymptomatic 90% blockage, which includes aspirin 80 milligrams, a high intensity statin medication, which could be atorvastatin 80 milligrams or 40 milligrams. It could be rosuvastatin 40 milligrams, and a couple of other options. Additionally, we will likely prescribe you a beta blocker like metoprolol or carvedilol. And friends, with these three conditions, the 90% blockage in an asymptomatic patient can be safely stabilized, and the progression can be halted. Obviously, you have to pay close attention to your lifestyle, which includes reducing the food that causes inflammation, specifically red meat and processed foods. And you have to take more fresh fruits, fresh vegetables, and home cooked food with less salt and less oil. So, friends, to conclude, in asymptomatic patients, mostly we do not recommend advanced testing. We only recommend calcium score, which basically is a CAT scan which will tell you the percentage of calcium in your heart, and you can use this as a motivator to improve your lifestyle. And additionally, if you have high calcium score, then we will recommend a cholesterol lowering medication like a statin medication, which will help to reduce your chance of heart attacks in the future. But we typically do not recommend doing angiography or CT coronary angiography if you are asymptomatic. But if a test has shown a 90% blocked artery, then it is severe and it depends on where the blockage is, whether it should be treated just with medications or you may need stent or surgery. So, friends, if you have a 90% blockage and you are asymptomatic, please do not panic. Discuss this with your cardiologist to see which treatment is right for you. I hope you found this video helpful. Please like, share, and subscribe for more evidence based heart health insights. Thank you.